Separating the facts from the fear that is out there. It's one of the things we try to do with the KSAT Q&A and get some of your questions, our questions answered. And as he does every Wednesday, we are joined by San Antonio Mayor Ron Nirenberg, who joined us live after the briefing. Mr. Mayor, thank you for joining us. It's been a time where we have seen numbers added, numbers taken away, some confusion about what's happening with the state. Metro Health admitting that there were some double counts recently. How frustrating is that for you when you want to keep the focus on masks and social distancing and washing your hands and the fact that we are in a pandemic? How frustrating has that been?
It is frustrating on a number of levels. I would say, number one, we have a very high standard of accuracy and timeliness that we've established during this pandemic. And the truth of the matter is, people are stuck in home and looking at this data on an hourly basis sometimes and want to know the latest. And so there is an expectation set on the part of everyone in this country now that we need some information and we need it now. We put some of the health professionals on a little bit of a bind though, because if it weren't for this pandemic, some of this data would be coming to us and clean and verified over a period of years, not a period of hours. So we're condensing this. I will say that what has complicated this entire process is that the state of Texas has changed the methodology by which they report data more than twice with regard to deaths, with regard to how we count positive cases. And some of that is in conflict with not only the CDC and cities around the country, but also with our own standards of accuracy. When we report a data, whether it's a positive case or a death in this community, we want to make sure it's factual. And sometimes, and quite often over the last couple of weeks, what we're getting back from the state is not that.
Mayor, you talk about your frustration, and you mentioned two people looking at this information. We're all trying to make decisions about our daily lives, let alone the big decision of back to school, based on an accurate depiction of where we are at this point in this pandemic. So what's your message to people watching this at home, people who are looking at that data at home? What's your message to them about how they should be interpreting all of this confusion and also the city's effort to try to make this as accurate as possible?
So people should feel confident when you go to covid19.sanantonio.gov, you will see a complete and accurate picture of where we are. But we've been cautioning folks from the very start, don't get caught up in the daily case numbers because what we want to do is look at trends. And what we are seeing in the trends has remained true throughout this entire period. We've seen a bit of a peak back in April, which came down because we all started getting devoted to physical distancing and mask wearing. Then we saw the spike that occurred as a result of the reopening speed of Texas and the lowering of the face masks, as well as the limiting of local authority. And we saw a huge spike and an acceleration of cases. We have now, with the state backing up our face mask orders and a recommitment for all of us to physical distancing, started to see those numbers plateau and even now start to come down. That's where we are, but this is no time to let off of our commitment and let our guard down. What we have to do is continue to drive down transmission as much as we possibly can as we get towards a period in the fall when we know there's more infection of respiratory disease, schools are beginning to open, as well as all the other activities that happen during the fall, like Labor Day. So we've got to continue to work to keep those numbers moving in the right direction. This has already placed a deadly toll on our community, but what we are doing by physical distancing and mask wearing is working. We just have to keep it up.
San Antonio Mayor Ron Nirenberg, going to ask you to stay with us for one more segment. I want to talk about schools and the town hall that's just a few minutes away. We'll be right back.
We're back with the mayor now in our Q&A. And Mayor, last week we had the interim director of Metro Health, Dr. Colleen Bridger, on this segment to talk about whether it's possible for a positive patient to be counted more than once in Metro Health's totals. We were told at that point no, but then on Monday we heard that that's because duplicates were removed. The reason being is because someone was counted potentially 4 or 5 times. She said that's not out of the question. So what happened to make that possible? I mean, we thought the answer was there could be no duplicates. It seems like some were duplicates.
This seems, and it also
Yeah.
fits in. I mean, you're also finding social media in this whole getting the messaging out, and there are a lot of conspiracy theories out there that people are being
Absolutely.
counted double.
Yeah, so we do know that there's 41,000, I believe, cases, total cases. We know those are unique cases because the scenario that we found was that in about 1%, there were multiple reports of a person testing positive because they took multiple tests, but the reporting agency changed something about their contact information, the spelling of their name, something that made it a unique case within the system. So Metro Health went through all those manually to remove those duplicates, and it was a roughly, I think, 600 cases out of the 40,000. So a relatively small number, but the manual duplication found those cases in which there was a different spelling of a name or a different name or a different contact address or something like that.
All right, so we've got a town hall coming up in about a little less than 10 minutes here on the city's website and the city's television channel about back to school. Specifically, will a new health initiative be announced for Metro Health during this news conference, or when can we expect that?
So there won't be a new directive in terms of what Metro Health and the Public Health Authority is recommending to keep students, families, teachers, staff safe. But what is going to happen tonight is feedback from the community, all stakeholders who are part of this town hall, but also a linking of metrics to when schools could be opening safely. So the metrics that they have already talked about, which will be discussed tonight, are the positivity rate, which is happening in our community, which at its high point was about 25%. Back in May, it was at a low point at 3.5%. Right now, it's at 15%. We need it right around 5% once we start opening up. So positivity rate being one. We also want to see a sustained 2-week decline of cases, and we've begun that trend in the right direction, but we're not there yet. And then, of course, the doubling rate, how long it takes to double the number of cases of infections in our community. That's a measure of how fast it's spreading in our city. And we were at a very low point, I think right around 12, 14 days. We moved up to 16, 18, and now we're 21 days. So we're in better shape there. But those are the kinds of measures and metrics that Dr. Wu and the public health community want to discuss with the school communities to make sure that we have metrics associated when we open schools safely.
All right, and that town hall happening at 7 o'clock tonight. You can watch it on the city's website, the city's television channel, also the city's Facebook page. Mayor Ron Nirenberg, thanks for being with us as always.
Thanks, y'all. Be safe.
We'll be right back.